Hi, this is Dr. Serena Satcher, and we're talking about lupus this month. We're addressing quite a number of questions that we were presenting with in regards to lupus. The next question is, how is lupus diagnosed? So there are 11 criteria for lupus diagnosis, and you can go to the American College of Rheumatology website at rheumatology.org to look at those criteria. But some of the criteria include the rash, the butterfly rash on the face, discoid type rash that could be anywhere in the body, photosensitivity, which means sensitivity to sun, oral and nasal ulcers, all types of joint pains, inflammation of the lining around the lungs or the heart, kidney disease, neurological disorders of the brain and nervous system, blood disorders, and they name certain blood disorders, Raynaud's phenomena, in which the tips of the fingers and the toes can go red, white, and blue. So join me for the next question that I answer on the next segment. And I'm Dr. Serena Satcher, and you can reach me at treatyourself2health.com or on social media at treatyourself2health. Thank you.